Good morning all. Today we are going to learn about essential things to know before practicing yoga. First one is time of practice. Yoga can be practiced at any time of the day except after meals. The stomach should be empty while doing asana, and to ensure this, one should practice after 3 or 4 hours of meal. The bladder and intestine should preferably be empty before starting the session of asana and pranayama. The best time, however, is the 2 hours before and including sunrise. Place of practice. Practice in a well-ventilated room or outdoors while surroundings are pleasant. It should be a beautiful garden with trees and flowers. It is advised that people with asthma or any other breathing problems should practice under roof. Yoga mat. Use a folded blanket of natural material for the practices, as this will act an insulator between the body and the earth. Clothing. During practice, it is better to wear loose, light and comfortable clothing of cotton. Though it is not mandatory to take a cold shower before starting, but it is greatly improves the effect of asana. Approach to practice. There is a proper manner to approach any practice, so it is most important to follow the guidelines on how to start the practice and how to move gradually to the final position. Holding time. Hold the final position of any asana till you feel comfortable and then release it. Try not to hold the posture while body is undergoing pain or discomfort. Always breathe through the nose unless specific instructions are given. Try to coordinate the breath with the asana practice. Release. To release the posture, one should not be quick and hurry, otherwise the alignment of the body may be disturbed. There may be a strain on the ligaments, so it is equally important how to release the final posture. Awareness. It is essential that the practice of asana and all other yoga practices should be done with awareness. The purpose of asana is to influence, integrate and harmonize of all the levels of being: physical, pranic, mental, emotional, psychic and spiritual. At first, it may appear that asanas are merely concerned with the physical level because they deal with the movement of different parts of the body. While practicing the awareness, we can be on the physical movements, coordination of breath, mental counting and movement of energy in the body and the corresponding thoughts and feelings. Awareness is an essential component of practice for receiving optimum benefits. As you become familiar with any practice, perform it with eyes closed unless there is specific instruction to keep the eyes open to develop better awareness. Relaxation. It is important to relax during asana practice, especially when feeling physically or mentally tired. It can be done in savasana, maharasana or any other relaxation posture. Counter pose. Counter pose is necessary to bring the body back to a balanced state. Backward bends are followed by forward bends and vice versa, and whatever is practiced on one side of the body is repeated on the other side. When practicing a particular asana for therapeutic reasons, a counter pose may not be needed. No straining. Never exert undue force while doing asanas. Beginners may find their muscles stiff at first, but after several weeks of regular practice, they will be surprised to find that their muscles are suppler. If there is excessive pain in any part of the body, the asana should be terminated immediately, and if necessary, medical advice may be taught. Sequence. Asana should be done first, followed by pranayama, then pratyahara and dharana, which lead to meditation. Diet. Yoga does not say that a vegetarian diet is essential, but in the beginning stages of practice, it is recommended. At meal times, it is advised to half-fill stomach with food, 1/4 with water, and leave the remaining quarter empty. Water should be taken 1 hour after food. Age limitations. Asana can be practiced by people of all age groups. It is better to avoid practicing asana and pranayama during menstruation and pregnancy. Caution. People with fractured bone or who are suffering from chronic ailments and diseases such as stomach ulcer, tuberculosis or hernia, and those recovering from operations should consult a yoga expert or doctor before commencing any yoga practices.